Endoscopy is a technique that we use to look inside any orifice of the body. So we use endoscopy to go into the mouth, to look down into the stomach and into the small intestine. Colonoscopy is where you come up the back end. Rhinoscopy is where you can look up in the nose. Otoscopy is where we look in the ears. So any orifice would be considered endoscopy. You're using a scope to look into something, which is by definition what endoscopy is. We could find a foreign body or a tumor or a really bad infection. But that's also a therapeutic tool, because we can also use that camera to get a biopsy and possibly remove a foreign body if we find a cheatgrass seed, for example. So it's diagnostic and a therapeutic tool. The same thing holds true for cystoscopy, which is scopes of the urinary bladder. We can put a scope into the urinary bladder and get a diagnosis. We can see if there's a bladder stone or a bladder tumor. We can get biopsies to confirm that. But we can also resolve the problem. A lot of those stones can be removed with the scope. You can grab the stones and remove them, or flush them out with the assistance of the scope. So that's a therapeutic tool as well as a diagnostic tool. And I think that's just a wonderful and powerful tool that we have to offer our clients, that we don't have to take them to surgery. We can fix the problem without having to do surgery.